For the last 2 months, I have been in Wuhan in this fighting with COVID-19 disease. Actually, from February 13th to April 13th, 2020, I have been in 2 hospitals. First one is the first civil hospital of Wuhan. The whole hospital has received over 1,000 COVID-19 patients totally. We have stayed there over a month, and then after that, we have been transferred to Jinyintan Hospital in Wuhan. This Jinyintan Hospital was supposed to be the most legendary hospital in Wuhan history because it has received over 1,500 COVID-19 disease patients. And most of the cases were quite severe. Yeah, with the great, unbelievable work of my colleagues and our peer professionals, most of the patients right now has been discharged from the hospital, and the city of Wuhan has been brought back to life. It was wonderful to see, to be evidenced by the whole procedure. I'm glad I was part of them. I was part of the whole team. Well, I would like to show you some pictures of my team. The background was the Jinyintan Hospital, and this is part of my my team, my sweet colleagues. They were working with us all together for totally 2 months. It's unbelievable work. I really love them. And this one is me with one of my colleagues doing intravenous catheterization. Well, everything became very difficult in that situation because you've got to wear personal protective equipment with sometimes with 3 layers of gloves. It's relatively difficult. You don't have clear sight. You don't have very sensitive touches. So things became hard during that situation. This is one of my colleagues doing CPR for a person, for a patient. This patient was in very difficult situation. He didn't survive. He did not went through this whole situation because he got very severe cardiac shock after COVID-19 disease. And you know, it's the very common complication of COVID-19. Usually, COVID-19 itself can cause myocarditis and sometimes very severe cardiac shock. And during such situation, the patient heart doesn't respond to any catecholamines, including adrenaline, noradrenaline, or sometimes even isoproadrenaline. Even atropine doesn't stimulate the heart to pump. So finally, the patient doesn't make through. Yeah, it was a sad story. Well, at last, the picture, it's my wonderful, wonderful ECMO team. They're great, excellent doctors and nurses. They have made great effort to make those 2 ECMO cases. But sadly, finally, none of them have survived this COVID-19 disease. And when we were transferred into Jinyintan Hospital, we have been shifted into another ECMO case. That case was a 50-year-old woman. Sadly, her heart function was not okay, and she didn't survive the COVID-19 either. And she didn't even get a chance for lung transplantation. That was pretty difficult for us, not only for the patient itself, but for the families, for our professionals. But anyway, we did our best to try. And well, this is an interesting case, but I don't have the full history. I can only tell you about it. It's a 52-year-old man with COVID-19. He got this disease through this February, and the CT scan shows the typical change of a COVID-19 disease. I will show you one by one. First picture. This first picture shows the typical focal lesions of COVID-19 disease. I'm sorry, I just have to shut the telephone down, okay? Just 1 second. 喂，潘总，我在一个网络会上，所以我不能来参加了，抱歉。对，我不能，我在一个网络会上正在主持，抱歉。我跟乔丽说过了，好吗 ？Sorry。哦，没事，因为我正在讲，抱歉。The first picture shows the typical focal lesions of COVID-19 disease in both lungs, especially in the peripheral area. The second one, I think it's kind of typical ground glass opacity, the famous GGO. It has been typical for any virus diseases. And the third one, it actually shows some consolidations of the COVID-19 disease. Would you like to take a wild guess? Did this patient survive COVID-19? Well, actually, he survived. With such severe lesion, he still survived with COVID-19 because of young age, because of relatively good organ function. But after this whole discharge, the patient had developed a bit of gastrointestinal hemorrhage. So he was transferred into a general hospital for further treatment. I think it will be good for him. Okay, I believe that will be the brief introduction of my experience and my major work in Wuhan. So back to you, Yao Xin.
Yes, thank you, Professor Han. Because many of the attendees, they complain me they can only see you, but they cannot see your PPT. Can you see what we can do? Like there, you have to share your screen with the audience so that they can see all your visuals as well. They can only see you, but they cannot see your presentation. Bikram, can you do anything in that?
Let's see.
I think I can see it very well, but I don't know why there is some problem with others.
I did share my screen with webinar online, but
yeah, you can share 1 second.
Okay, let's try.
Yeah, many of the attendees, they send me a text that say it's coming black and white screen. So they cannot see your presentation.
You can share once again. Yeah, I can see now.
Now you can see it.
Yeah.
Good.
Yes. Can you check? Yeah. Can you check, everyone, please? Yeah, from the starting.
You
yeah.
have to click in a presentation.
Sorry, once again, Bikram, can you guide?
The participants attendee have to click in the presentation slide. There is two screens. One screen is in video, and one is in screen in slide. Yeah, let's go ahead.
Can we do these slides one more time, Professor Han? Just the slides and the photos I think they wanted to see, and also the city report, I guess.
the first slide. This is the, so do I have to go through with it again?
Okay. Yeah, I think you can just show the, yeah, like this is better, I think. Yeah. I think everyone can see this, I guess.
Yeah, you think it's acceptable? I can go with it again, no problem.
Yeah, if not trouble for you, please.
Sure. This technical problems always troubling us, you know.
Yes. Sorry for that.
No problem. Okay, this is Dr. Han Yi from Nanjing Medical University, the first affiliated hospital actually. I have been working in ICU for over 10 years and I have graduated like almost 20 years ago. I have been working in Wuhan for the fighting of COVID-19 for about 2 months with my colleagues. First in the first civil hospital in Wuhan. This hospital has received about 1,000 COVID-19 patients. And after that, we have been transferred into Jinyintan Hospital. This hospital had received more than 1,500 COVID-19 disease patients. And most of the patients were in relatively severe situation and part of them were in ICU wards. Yeah, this picture shows the legendary Jinyintan Hospital and part of my excellent colleagues. And this one shows me and one of my colleagues doing intravenous catheterization. During that situation, everything became very difficult because you don't have clear eyesight because of the protection safety goggles. And sometimes you've got to wear 3 layers of gloves. Things are difficult. Now this is the patient undergoing CPR by one of my colleagues. The patient finally did not survive COVID-19 because of organ dysfunction, especially heart failure. He got myocarditis after COVID-19. This is my excellent ECMO team. I am very much proud of them. They're excellent doctors and nurses. We had 2 ECMO cases. None of them survived this COVID-19 because of organ dysfunction, old age, very poor lung lesions. So it was quite difficult. And after that, after we have been transferred to Jinyintan Hospital, we've got another ECMO patient, a younger one, about 50 years old female. She did not survive COVID-19 either. It was quite difficult for our physicians or the professionals. Although we do have some good news for ECMO because two of the COVID-19 disease patients have actually survived because of ECMO, and right now they're in relatively good situation. This one, I think it's a typical change of the CT scans of a COVID-19 disease. First, let's see. I'd like to show you some pictures. Oh God. Not like this. Am my screen accessible online right now?
You have to make it full screen. Yeah, we can see you.
Okay.
We can see all the presentation.
Right now? What about now?
Yes, Professor. Yes, we can see.
Okay, right now, we see the first picture. This is the focal lesion of a typical COVID-19 disease. The focal lesions usually exist in the peripheral area of both lungs. And the second one, it shows the typical ground glass opacities of COVID-19. The third picture actually shows part of consolidations and the fibrosis of COVID-19. It's a good case though. Sometimes COVID-19 patients might develop emphysema, not only because of mechanical ventilation, but the virus itself might destroy the lung tissue to create unexplainable emphysema. So it's relatively difficult for such patients to fully recover from this disease. I believe in a year time or a year or later, such lesion may not be totally recoverable. Okay, luckily the patients actually finally survived this COVID-19 disease. And after that, he actually developed gastrointestinal hemorrhage, but he was transferred into a general hospital for special operations, and the outcome was very good. Thank you so much. Back to you, Roshan.
Thank you very much, Professor Han. It was excellent presentation, and I hope my audiences, everyone, had a great chance to meet you and share. And we'll still have questions coming up. So first of all, I would like to have a presentation from Dr. Yao as well. Welcome, Dr. Yao. So you were also in the first line of defense. You work in Wuhan as well. And Dr. Yao, he is a professor of respiratory department, and he also been to Wuhan in the front line. So we'd like to hear from you, Dr. Yao.
Yeah, that's you, Sam. I didn't work in Wuhan. I just worked in another city of in Wuhan province. I worked in Huangshi city, a city nearby Wuhan. And at that time, I worked in. I do not have PPT. I just express with my word.
Yeah, no problem. No problem, Professor.
In Huangshi, I worked in Huangshi Chinese Hospital of Traditional Medicine. And in nearly all the severe patients in Huangshi, in that city, will be transferred transferred to that hospital for further treatment. And also some mild or moderate cases will also be admitted. And in that hospital, at that time, there were about 5 wards for mild or moderate cases, and 2 wards for some severe cases, and 1 for ICU unit, for ICU. When I arrived there, it was about 234 inpatients. Among them, 160 were mild or moderate cases, and 74 were severe or very severe cases. And that's the situation at that time. Yeah.
Thank you, Professor Yao. We'll have other questions for you later on. So we are still waiting for our one more speaker, Professor Wang from Epidemiology and Public Health Department. I think he's having some problem accessing to the internet. So let me see if he can. I think he's not there. Still, he's trying to get a connection. So anyway, Bikram, you there? We can have some questions for Professor Han and Professor Yao.
Yeah.
Yeah. Okay. Please.
Yeah. I think we have Dr. Rajiv raising a hand there. Dr. Rajiv, you can put your questions. Dr. Rajiv Shrestha. Bikram, can we give access to Dr. Rajiv Shrestha for his questions? Dr. Rajiv or Dr. Priyanka? Yes.
I think there's a function called mute unmute, which
Yes.
is not available in everyone's computer.
Okay.
Biroma, I have it, but it's not there in other people's. That's why they cannot speak.
Oh, really? Bikram, can you click on that, please?
Okay, I think it's working. Can
Yes,
I
now,
ask one question?
now every can get talk.
Okay, can I ask a question? Hello?
Yeah.
Yeah,
Yes,
Dr.
please
Asim.
go ahead.
Yeah. So what preventive measures did the doctor take while working in the ICU with the COVID-19 patients? Did they take any prophylactic drugs apart from the PPEs?
Okay, this question is for Professor Han, I guess.
Yeah.
Professor Han?
Yeah, sure. Apart from PPE, we would have sanitizers for each bed, and each room of the ICU bed should be sterilized by ultraviolets. For if we close the wards without send the patient out of the wards, then the rooms shall be steriled by ultraviolets. Sanitized are the basic protection, both for patients and for professionals. And,
did the doctors take any preventive measures?
I request whoever is not speaking, just mute.
Mute the speaker, please. Dr. Rajiv?
Yes.
Yeah, can you put your questions, please?
Yeah, I would like to put a question to Dr. Han.
Yeah, sure.
So I would like to know if there are any patients who is having cardiovascular mortalities or cardiovascular disease before, and these kind of patients who have been infected with COVID-19. So what were the treatments and how do you deal with these kind of patients?
Yeah, there were actually plenty of patients who had complications of cardiovascular disease for COVID-19. It was actually very complicated and very severe. We have very little method to prevent such thing. Usually we might, we had even tried CRRT, renal replacement therapy, to clear out the cytokines that damages the heart function. We also tried to use IL-6 antibodies to try to suppress the inflammation, but nothing worked very much well. The best method actually for cardiac shock complicated by COVID-19 is actually VA ECMO, but that was very, very much expensive and very difficult to access. To protect a heart function during COVID-19, we may use some very basic methods like nutritional support of the myocardium, but I don't think it works very well. So we just have supportive measures for that. Thank you.
Do we have any patients using intra-aortic balloon pump rather than ECMO, because ECMO is a very expensive one? So does the intra-aortic balloon pump have any role in this kind of cardiogenic shock patients?
Do you mean, do we use interleukin 6 antibodies?
IABP, I'm talking about IABP, intra-aortic balloon pump.
We do use that once in a while, but I don't see improvement outcomes yet. It is very hard.
Okay,
Thank you. Thank you,
Han.
Dr. Rajiv. Thank you. We have a student who is currently in China. Dr. Han, he is our alumni as well, and he's doing his PhD. Dr. Sachin is there. Can we put the question, Dr. Sachin? Bikram, can you help him with the speaker, please? Dr. Sachin?
He can speak.
Can you
Just
put your
unmute.
question, Dr. Sachin? Can you unmute and put the question, Dr. Sachin? Dr. Sachin?
I see very many questions online already. So
Yes.
may not be able to one by one.
Yes, yes. So we have Dr. We have Sandeep Shrestha. Dr. Sandeep? Dr. Sachin? Dr. Sandeep? Anyone can?
Hello,
Can
hello.
Yes,
Hello.
Sandeep.
Sandeep, yeah.
Yeah, Dr.
Yeah,
Sandeep.
it's one question is like, as we all the medical persons are working in the hospital, in the ICU ward, so like any doctors need to take any prophylactic drugs, like Yufang Yao, like prophylactic drugs before we go work in the hospitals, especially in the ICU.
All right, that's a good question. In China, we usually take prophylaxis for COVID-19 for professionals. At the beginning, it's just in our team. I don't know other professionals. It's just in our team. We have been taking Abidol for a while. I don't know it's useful or not, but later on, it has been proved to have no effect at all right? And after that, we have been applied with thymosin for a while. It's an immunomodulator trying to protect us from being infected by this virus. Generally, I don't think it's going to be very much useful, but it's just for protective purposes, from the government or maybe from the hospital to protect us. It's a good point, though. It may be helpful, maybe not. I don't see the exact effects, but anyway, we have about 200 professionals totally in our team. None of us has got infected from this virus. So I think, do you think this is a good result?
Is there any kind of traditional medicines that Chinese doctors they use for the prophylactic?
Yeah, we do have traditional Chinese medicine being applied for COVID-19. I personally would not strongly recommend traditional Chinese medicine because it may be not very much accessible to you guys. But for us, lots of patients has been taking Lianhua Qingwenjiaonang, the famous one. Although personally, I don't think it will be of very much use because US FDA has never approved of not even one drug to be both of safety and the effectiveness for antiviral purposes. So I don't think it's very much useful. Up to now, for so many histories of medication to antivirus, nothing is of very much use. We just have to keep the whole body in a good shape. Then it may be the good chance to survive the infection.
Okay. Thank you, Dr. Han. Thank you,
Dr. Sandeep. And Dr. Sachin, you there? Can you put your question, please?
Hello.
Yes, we can hear you. Please.
Rosen?
Yes, we can hear you. Please put your question.
Okay, thank you very much. Good afternoon, Dr. Han.
Good afternoon.
Ma'am, I'm right now in Nanjing, studying in Tongnan Kasui, Southeast University. So my question for you is, could you give us some more information about the therapy of blood transfusion from previously infected and healed patients?
Am I right that you were asking about the problem of blood transfusion for COVID-19?
Yes, yes, ma'am. Because we have seen in the news and heard that like the patients who have been treated with COVID-19, and those patients, the blood has been drawn from them, and then those bloods are given to the new patients, newly infected patients. And so what is the role of these blood transfusions from the previously infected patients to newly infected patients?
You mean actually the convalescent plasma?
Yeah. Yes.
Right. Yeah. I personally recommend this treatment measure, and also United States FDA has approved of this measure to treat. This is a classical one. This has been worked in Ebola, but I'm not sure it's effective or not. At least some patients have tried this one. I don't see, although I don't see the effect, but also I don't see the side effects. So the safety supposed to be assured, and rationally it's supposed to be useful. Well, for the donors, I would say the donors supposed to be 18 to 55 years old and have been infected by the virus, and the nucleic acid test supposed to be negative at least twice with sampling intervals for at least 24 hours. All right. And both the virus-related IgG and IgM test better be, the IgG test could be positive, but IgM test is supposed to be negative. Then the blood could be drawn from the convalescent patient, and the plasma is supposed to be separated to apply to a new patient. And the indications of this convalescent plasma are supposed to be applied to critical patients or worsening patient with a rapid speed, or applied to severe cases. Mild and moderate cases are not the indications. You know, relatively mild and moderate cases can survive the COVID-19 disease by him or herself. So only critical or severe cases are the indications. Do you think that's good enough?
Yeah, thank you very much, ma'am.
Thank you.
Thank you, Sachin, for your question. And can we have a question from Bidata? Bidata, are you there?
Hello.
Yes, Bidata, go ahead.
I'm Dr. Vidata. I'm a pediatrician by profession, and I have one question for Dr. Han Yu and one question for Dr. Yao Xin. And the first question for Dr. Han Yu is, if the patient have a positive travel history within 2 weeks or contact with a COVID-19 virus positive patient, but with no symptoms, when is an appropriate time to take a nasopharyngeal swab for those patients? This is for Dr. Hani.
Okay.
And the other question is to Dr. Yao Xin regarding the test for COVID-19. How much sensitives are rapid tests, PCR and CT tests according to the experience in China? So these are my two questions for Dr. Han Yu and Yao Xin. Thank you.
Okay. For the first question, sorry, Professor Yao, should I begin first?
Yeah, you first.
Okay. For the first question, if the patient had contact with COVID-19 patients or had a traveling history to epidemic regions, it should be it should be treated as suspect case. You know, suspect cases should be tested with nucleic acid and virus-related IgG and IgMs. Once the nucleic acid testing was negative twice, at least twice, and remember the sampling intervals should be over 24 hours. If this nucleic acid testing was negative and the IgG and IgM testing were negative as well, the patient could be ruled out of this suspect diagnosis. Then it could be sent back home. And remember, the IgG and IgM test should be taken after 7 days of the first contact, you know, to give the virus a bit of incubation time.
For me is like I wanted to ask what would be the appropriate time for a nasopharyngeal swab, ma'am. Earlier you said about the PCR, but what would be the appropriate time to take a nasopharyngeal swab? For means you said that it would be as soon as we got the patient with the contact, or we should take it in 24 hours, or what would be the appropriate time?
As early as possible.
As early as
admission immediately.
Okay, thank you so much, ma'am.
No problem.
Yeah. So the next question is about the sensitive of the rapid test and the PCR and the CT chest scan. Is that in China, right? So for the rapid test, I think they are detecting the I think the IgM or IgG for the viruses, for the virus. Then I think for that kind of rapid test, the sensitivity and the specificity of such kind of tests would be very high, very fine. I mean, the accuracy is very good, very good. And however, it's just as Dr. Han Yi said, it might let you know whether the patient has been affected by the virus. And for PCR amplification of the virus, and you will provide the information of the disease. However, this kind of test, I mean the PCR amplification of the genes, might be affected by the kit, PCR kits, the sampling, and maybe the local expression of the viruses in his throat or something like that. And so sometimes it's not so sensitive. However, it will give you the information whether the virus is being proliferation in your body. And for the image of the CT would be quite helpful. However, it's not specific. And you know, also some other viral infections, you know, may also have the same presentation in CT scan and not so specific. And sometimes we have to make the differential diagnosis with the other viral infection. And also some patients infected with the COVID-19 may not show the sign of the infiltration in the lung field in the CT scan. Maybe they are especially for this asymptomatic. So, well, it's a really difficult question for the sensitivity and the specificity of you know, for the rapid test, PCR test, and the CT scan. Each one has its role on the treatment of the diagnosis.
Sir, I continue with the other question following with that. If the rapid test shows IgM positive, followed by the negative PCR, is the patient still need to be isolated as a COVID-19 patient?
In my idea, in my suggestion, I would suggest the patients would stay quarantined for about 2 weeks, because because the transmission rate of the viruses is so high. In such cases, especially in IgM, the patient is still the high pressure of IgM in their blood. I think probably it's better for this kind of patients to keep in quarantine for another 2 weeks.
Thank you so much, sir. And sorry, I have one more question. As you have explained so nicely, as of now, we came to know that incubation period of the virus is more than 14 days. So, what is your view whether we need to extend the isolation time or not?
Just as mentioned by Dr. Han Yi, in China, if we come back from some pandemic areas, such as in the Hubei province previously, or now some foreign countries, you will be required for quarantine at least 14 days. That is according to the regulation by the nation. I think it does work well in China for 2 weeks quarantine.
But in our concept of our Nepal, sir, we have 3 or 4 cases who had been positive after 1 month, and some had been after 28 days. So is 14 days enough, sir?
Yeah, should be fine. I mean, it's a different system. If a difference in China, we would ask the patient, we will let the patient to stay at the hospital when it is positive for the virus test. I mean the PCR amplification of the viruses, and until it is negative for twice. And after discharge, I mean it shows the negative for the second time, and they will be discharged. After discharge, they still will kept quarantine for another 2 weeks. And during the 2 weeks, at the end of the 2 weeks, it still was negative. They can go home. That's a different system between our country and the Nepal, probably.
Okay, thank you, sir. As I'm a pediatrician, so I would like to ask, sir, I don't know whom to address this question. As I being a pediatrician, I wanted to go ahead with the one question for whoever could answer for me. Pediatric patients are, as we have been knowing, that they are low in risk. They have a low mortality rate. But even though they have a low mortality rate, they have a very low immune system. So what could be the prevention measures we can take for these pediatric cases or pediatric age group?
Yeah, for me, there is still, we do not have some, for my opinion, there is no such kind of specific measures we can take. Yeah. For the pediatric patients, because most of the pediatric patients would be not so severe. Yeah.
Thank you, sir.
Yeah, thank you, Dr. Vidata, and thank you
so much,
Professor Yao. We have a next question from we have Professor Wang. So, Professor Wang Jianming, can you hear us? Professor Wang? Professor Wang, can you hear us? I think he's having a technical difficulty. Professor Wang? Professor Wang, can you hear us? Okay, so we'll go ahead with the questioning. I think we have Dr. Priyanka here. Dr. Priyanka, can you put your question, please?
Yes. Hello, everyone. Good afternoon. Can you hear me?
Yeah.
Yes. Yes,
Yes.
Priyanka.
Hello.
Yes.
Yeah. Hello, Dr. Yao. Hello, Dr. Okay, so my question is for you. I'm from Nepal. So we recently have this, like 2 patients who had traveled from outside our country, Nepal. So they were tested positive for COVID-19. And there was another family member who was tested negative. Hello?
I'm
Hello?
not so clear
Yeah,
because
yeah.
there's some echo sound
Your
in
voice is,
your microphone.
your
Okay,
voice
so
is
can
breaking.
you hear me now? Okay, can you hear me now? Hello?
Yes, can you
Still.
go slowly?
Yeah, sure. Okay, so my question for you is, in my country, recently, there were like 2 people traveled from outside Nepal. So they had to come here and they were tested positive for COVID-19.
Yeah.
Can you hear me? Yeah?
Yeah. Yeah.
And they were, so they were living in a house. So there were like many other family members too. Okay. So the people who traveled from outside, they were tested positive. But the family members who were in Nepal, they were tested negative. So are you following me?
Cannot follow. That means that the 2 foreigners come to Nepal, right?
Yeah, no. Yes. They came from outside Nepal.
And he contacted some family in Nepal.
Oh, no. I mean, they were tested positive for COVID-19, but the family members who were living in Nepal, they were tested negative. Yeah. Right. So my question for you is like, so how can we identify the people if they were COVID negative? Then we isolate them for some days. Then do we again have to test them? Then can you tell me like when can we test and what are the things that the family members who were tested negative can do except isolating themselves? Is there any other measures to prevent?
I'm not so clear. I mean that you mean the family member has been test positive. A family member test positive for the virus, right? And for the other families, what we will do with the other families, right?
Yes, who were tested negative. Yeah.
But I think, for other families, in my idea or opinion, probably the other families will, that means so the infected family member will kept isolated, right? And the other families family members still, in my idea, you still need the isolation too for 2 weeks, although it is negative, just like before I explained from the pandemic area.
Okay, so after 2 weeks, they need to be tested again?
Yeah. In my idea, sure.
Okay. And if they are again negative, then they don't have to stay in isolation. Is that correct?
Sorry, cities? You mean you means you do the CT scan for them?
Hello.
Yeah. But what's the last question?
Okay, so after the isolation, if they again become negative, then they don't have to go back to isolation, right?
Yeah.
Okay.
Yeah,
So
that
that
will
was
not
my
need to
confusion.
be
Thank you,
isolated.
doctor.
Yeah.
Okay, thank you, Dr. Priyanka. I think we have Professor Wang back. Professor Wang, you here? Professor Wang Jianming. Bikram, can you check is everything okay with his? He said he don't have access.
No, he's okay.
Yeah, Professor Wang. Professor Wang, can you hear us, Professor Wang? Yeah, still he's there, but I don't think he can hear us. Or
Okay, Rosen, can I ask a question, quick
yeah,
question? Because
yeah, Dr. Jagdish, yeah.
okay, thank you for your experience, sharing your experience, Dr. Han and Dr. Sin. Yeah, since I see that Dr. Han is also works in geriatrics, so how did you manage the triage for people? How do you select the people who will be getting better care? Did you do that in China, for example, who will have access to ventilators if necessary, or who will not be getting the ventilators on the benefit risk ratio? Did you do that in China, or everyone had equal treatment opportunity in China? Because as you know, in Italy or in United States, older people are not getting a lot of attention for ICU care or ventilators. So did you have that kind of problems in China? If so, how did you manage that? And so that is one of the questions I wanted to ask Dr. Han, and maybe Dr. Sin can even add his experience with older peoples.
Yeah, I think that's a very hard question. It's a very difficult situation to select. We are professionals. We are not God. We got no right to select the patient to die or to survive. And the only thing we can do is to evaluate the prognosis, the probable prognosis of a patient. And
how did you evaluate the prognosis? Using what kind of tools or what kind of methods did you use to evaluate who will be recovering fast or who will not have a better chance of surviving? How did you do that?
As an ICU physician, we have a whole set of evaluation scoring system, like a SOFR score,
okay,
or a patch 2 score. Generally, we can evaluate the general organ functions and the severity of the disease or severity of the infection. If we see the patient is generally in a better situation, we might, let's say, if we have just one ventilator, and we might apply the ventilator to a better prognosed patient. And we've got to follow the standard protocol for mechanical ventilation. We've got standard oxygen therapy. Then the patient could be under, if it doesn't approve the whole situation, the patient may be under high flow oxygen therapy or non-invasive ventilation. And after that, if it doesn't approve at all within 1 to 2 hours, then we might have to apply mechanical ventilation with tracheal intubation, of course. It's hard.
Okay.
Thank you.
So what I wanted to know was like the increase in age a risk factor for you to define the prognosis of a patient? I think so far the SOFA has age as a risk factor. Dr. Han? Can you hear me?
Dr. Han? Dr. Han, I think his screen is frozen. So thank you, Dr. Jagdish.
Okay, Dr. Sin, could you share a little bit about how did you triage in your experience for older people?
Dr. Yao?
Yeah.
Yes.
So what's the question? You mean the experience for some old patients, right?
Yeah,
with the
older
patients
people,
with old age.
How? Exactly. How did you select who is going to get a better opportunity of having ICU care or ventilator if needed? How did you decide?
Yeah, that's this is really a tough questions. But in Guangzhou, in the area, in the hospital where I worked, we have enough equipment and enough beds for such kind of patients. Well, but I think that depends, that depends on, I think, the availability of the
Resources, yes, exactly.
supplies.
That's what I'm saying. Yeah.
For in Huangshi at that time, for ICU beds is enough for such kind of patients. But you know, in some Europe,
Yeah,
especially
exactly.
Spain or Italy or something
Yeah.
like that, there probably may be the chance this treatment will give some much younger or sometimes. Because we have to acknowledge that for in such kind of patients with high ages, with means very old, they may be have a very low possibility of survive. So probably that depends on, you know, the availability of the medical supplies and the beds and the different countries and the different
So did you have a guideline issued by the government or the healthcare ministry to manage such kind of situation? Dr.
No,
Han,
we
could
do
you
not
answer
have.
that?
But usually
You don't
we
have
would.
that?
Yeah, usually we would treat who come first. We
All right.
the first come first serve.
Okay.
Yeah.
Which is not the younger first or older first issue, but first come first
In
serve.
China now, you for first come first serve.
Great.
Yeah.
Dr. Han, you want to add something? If you want.
I think you need to revise your question because Dr. Han got disconnected. So can you revise your question once to Dr. Han, please, Dr. Zagdi?
Dr. Han, it was the same question. How do you triage older people? It was the same question, and I wanted to ask if there were any guidelines issued by the governments for selecting a patient who has better prognosis and giving them higher opportunity of treatment. So already Dr. Yao answered that there are no such guidelines, and it is entirely based on first come, first served basis. So that's all of my question. Maybe Dr. Han would want to describe briefly to all our participants what exact tools could be better. For example, the SOFA score. You could explain that a little bit to other participants who may not be familiar with the SOFA score. That's all I have to say, if you are willing to answer that.
Sure. I generally agree with Dr. Yao Xin about how to select a patient to be on the ventilator or not. SOFA is just one of the many evaluation scores that I have mentioned, but generally we've got to evaluate the age, of course, and the comorbid conditions, such as if the patient is like 80 or even 90 years old, with very weak organ function. And if at the same time we have a relatively younger aged patient with relatively better organ function, then it will be, the prognosis will decide how to choose. But generally it's hard, you know.
Exactly.
And besides, the pulmonary function is our major concern. You know, if the lesions are too serious, if it's irreversible, if we think it's just irreversible, or the deterioration speed is too fast, it's just unstoppable, then we might not give the chance to much patients. Yeah.
Exactly.
Yeah.
So is the Apache score better than the SOFA? SOFA is the best score because I saw a couple of paper in Lancet. They have used SOFA to assess the prognosis in COVID-19 people, not only older people, but all kind of people. So what would you choose? Is Apache score a better score, or SOFA a better score? Or we have, I think, RAMS score, or even the Curve 65, where you don't use the CRV 65 score, I think, for pneumonia and those things. So which score is the best score if you want to use in an ICU setting?
In an ICU setting, to me, so far, can never be the best score. It's just the easiest one. It's the simplest one. It's easy to apply during that scenario. You know, you don't have a lot of time to
Okay.
totally evaluate a patient. A Part 2 score, I would recommend this, but it takes much longer time. It takes great effort to do this. And but a Part 2 score has very much more, much higher evaluative values. Would you agree with that?
All right. Yeah, I think so. Yeah. Anyway, thanks, Dr. Han and Dr. Yao. That's from my end, Dr. and Rosan. I think you can take some questions from others.
Yes. Thank you, Dr. Hani and Dr. Yao Xin. We still try to reconnect with Dr. Wang, but I think unfortunately he has not been able to connect it. So we have one of the doctor who is working in the trauma center in Kathmandu, Nepal, and he graduated from Chichihar Medical University in China. So we have a question from Dr. Ram. Dr. Ram, you there? Dr. Ram? I can see that you have to unmute, Dr. Ram.
Hello.
Yes, Dr. Ram, please go ahead with your question.
Hello. Yeah,
Yes.
Right now I have been working in the front lines in Bir Hospital, National Trauma Center. And my question is for Professor Han. As we have been working in the hospital for almost more than one month since the COVID-19 has started, and we are treating the patient, COVID-19 suspected patient, and the other patient together at the front lines, like at the emergency and in the ward. But because we don't have the separate hospital for COVID-19, so could you please tell me if we treat a patient having a suspected case of COVID-19 and the other patient in the same hospital, so is that
Hello, Dr. Ram?
Yeah, I'm over here. Am I?
Yeah, I
fine
cannot.
right now?
Yeah.
Yeah, I got the question.
You got the question. Okay.
Yeah. Yeah, during special situation, I totally understand your concern. You know, for suspect cases and confirmed cases of COVID-19, you've got to, life saving is always the number one, the top priority for our professionals, for doctors. You've got no right to stay away from it. But when you have to do some operation, you've got to wear protective equipment to do that. We have to save lives, but you've got to protect yourself first. And apart from that, I think the hospital generally should provide a separated operation room for suspect cases and confirmed cases of COVID-19. And such operation room should have a negative pressured environment to protect the professionals. And the basic things such as gloves, gowns, safety goggles, or even the face shield should be provided for such situation. Without such a situation, I don't think it's going to be fair enough for our professionals. At least a gown and N95 mask should be provided for doctors and nurses. Do you think this is okay with you?
I guess, yeah, your answer is correct. And that is one of the struggle we have been doing, you know, Dr. Han here. We don't have enough medical supplies, and that is one of the biggest dilemma for our doctors, because I think initially we are not prepared for the COVID-19. So we don't have a specialized hospital as we have in China. But the regional government has set up the specialized hospital for COVID-19 now. So we are in totally lockdown right now with the government initiation. That is one of the reason we are keeping tap on our numbers, because so the numbers will not increase. Till now, I think I have already mentioned we have 49 cases. Out of that, 11 has been treated and went back home. So other remainings are still under the isolation. But what the motive for this webinar is, like, we also wanted to prepare our medical practitioner for the disaster, because you know, the symptom has already been asymptomatic. So it may be anyone can be a carrier. So that is the reason we are worried. And I think to look from the epidemic perspective, we have Dr. Wang back, because I got a text from him. Dr. Wang Jianming, can you hear us? I don't know what's going on there, but we have one more question from Dr. Subi. Yeah, Dr. Subi, can you unmute and ask the question, please? Dr. Subi?
Hello there.
Yes,
You're
online.
Good afternoon, doctors. I'm Dr. Subi, from working currently in the the rural area of Nepal. So I was just wondering regarding the treatment for COVID-19. As you, Dr. Han, the question is for you. As you mentioned earlier, the using interleukin-6 for the treatment of COVID-19, and since it's not available here, so could the drugs like hydroxychloroquine and azithromycin be useful for the patient? And the other question is if a patient is a pregnant woman, is there any specific preventive measures that we could take for those women? The question is for Dr. Han. Thank you.
Okay, are you asking about hydroxychloroquine usage for this COVID-19, or?
Yeah, for COVID-19.
Okay, previously in China, we have tried quite a few cases on quite a few cases with HCQ. I mean, hydroxychloroquine. We have tried that quite a few, but personally, I don't see positive effects. And recently, very recently, United States FDA has eliminated this drug from the prescription panel. You know, this drug has been eliminated. It's moved away from the prescription panel because of its non-effectiveness and its toxicity. So I don't think it's safe enough. Because this drug can cause quite severe arrhythmia, sometimes even heart arrest. So personally, I would never recommend this medication. We have tried a lot on some patients, and United States had learned the lesson. I would not recommend Nepal to try this again. All right, and next question for pregnancy.
Yes.
You know, up to present, we don't see mother to newborn transmission of this COVID-19 disease. So if this pregnant woman is about to deliver a child, let her deliver the child first, and we should always negotiate with the patient first. If she wishes to deliver a child first, if not, we will start the treatment, and all the treatment would be were not safe for the newborn child. So if we start the medications, and we shall always consider about the possible outcomes of the pregnant women and the future child. So it's difficult. If we we don't have to consider about the delivery, then all the treatments should be the same with other COVID-19 patients. Yeah, for further information, I have never seen one pregnant COVID-19 patient yet, so I couldn't provide more information about it. I'm sorry about this.
Thank you. Thank you.
Thank you, Dr. Han.
Thank you, Dr. Subi, for your question. And we have one more doctor on the line. Dr. Sabin is here. Yeah, Dr. Sabin, can you just unmute and put your question, please?
Thank you, Rosande. Good afternoon, doctors. This is Dr. Sabin Cholagai from Nepal. I'm working at Shri Memorial Adventist Hospital here, and I have also been one of the team members who is on the front line managing COVID-19 positive patients. So my question is, there have been various hypotheses put forward at the etiology of COVID-19 SARS-CoV-2 causing pulmonary thrombosis and thromboembolism rather than the pneumonia and ARDS. So my question actually goes to Professor Hani about this hypothesis. Is it correct? Are we doing wrong management for the patients going for invasive mechanical ventilations? Is really the pathophysiology behind the pneumonia caused by COVID-19 is because of pulmonary thromboembolism?
About the pathophysiology of COVID-19, it's still debatable. I have seen quite a few hypotheses already. One of the hypotheses was that the virus mainly attacks the respiratory system and the cardiovascular system. That's why it has so much serious heart and lung problems with this COVID-19 disease. And another hypothesis is that this COVID virus attacks blood system. It mainly deassociates oxygen from hemoglobin. So it's actually a problem of the blood, then causing very severe hypoxemia. And both theories are, I cannot totally agree with both theories, but since there are no confirmed evidence of the whole pathophysiology, we can only treat the disease with supportive care. We can only treat the symptoms. We can never, right now, we could never know the root of the cause. It's really hard. It's a difficult question. It's a really good question. We would like to know further about the mechanisms of this whole COVID-19. I hope in the future, the scientists would get to discover new theories about this whole procedure.
Professor Hani, do you recommend we use plasma exchange
Am I
transfusion?
still online?
Yeah. You are online,
yes,
Dr. Hani. Yeah, we can hear you. Yeah. Can you hear us, Dr. Han?
Yeah, I can.
Yeah, we can hear you as well. Go ahead. Yeah, Dr. Sabin, go ahead.
Yeah, thank you for the chance of asking the question. Actually, my next question is, do you recommend using multiple plasma transfusions, exchange transfusions as a treatment modality? Could we possibly consider it as a treatment modality for COVID-19?
Yeah, because I don't see side effects of plasma transfusion yet, although I don't see much improvement of plasma transfusion. Rationally, it's supposed to be useful to treat this COVID-19, although we have to wait for more clinical trial results for that. But right now, I do agree with this plasma transfusion for this disease.
Thank you, Professor.
Okay.
Thank you, Dr. Sabin, for your question. And we have Dr. Sarat who is a ENT doctor. So Dr. Sarath, can you put your question and to whom? Please, you have to unmute your speaker.
Hello.
Yes, Dr. Sarath.
Hello, Professor Yao. First of all, thank you for your information. I have one question. During your period as a frontliner in Wuhan, did you find any patient who were treated successfully for COVID-19 and discharged and come again with the complication or side effect of COVID-19 treatment?
You mean the side effect?
Yeah, side effect or any complication after treatment.
Yeah, side it's I have to think about it. It's a really a question, a good question. But I think usually because usually we use some medicines just mentioned before, such as chloroquine and intravenous immunoglobulin and convalescent plasma and even anti-IL-6. But seldom we have some side effects because we keep closely observation on this. We didn't see such because when we apply such kind of measures, we usually very keen on the side effects of such kind of measure.
Okay, thank you, sir.
Yeah.
Okay, thank you, Dr. Sarath. I think Professor Wang still, yeah, he's here. Professor Wang? Professor Wang, can you hear us? He has been trying from his cell phone as well. So I don't know what. Yeah, Professor Wang? Professor Wang? We cannot hear you or we cannot see you as well. Can you hear us? Professor Wang? Okay, we have one more question. Dr. Abhirod Ranavat is there from Pokhara. Dr. Abhirod, can you just unmute and ask your question, please? Dr. Abhirod? Bikram, can you check like,
hello,
yeah.
hello.
Yes,
hello.
Dr. Abhirod.
Yeah, thank you very much for the question, for the chance to ask the question. Regards to everyone. My only one question is like, there are many unsymptomatic cases right now. So is there any way out? Is there any screening process to know those asymptomatic cases or not?
For my idea, probably for my idea, to try, you means try to identify the patient means with of asymptomatic, right?
Yeah, asymptomatic.
So I think the best way is try to is to ask the detailed contact history. However, it's really difficult because there are so many patients may be asymptomatic. So
yes.
you do not know what kind of patients he probably would meet or something. Really difficult. So sometimes I think in some countries they would try to do the test for the antibody or IgM or IgG to find such kind of asymptomatic patients. And for some patients with, the tested positive for his PCR, probably we would ask the patients to do the PCR test for the patients as well.
Okay, that means like for those patients or for those people who have the contact history or travel history, every patient they should undergo a screening test with PCR, right?
Yeah, that depends. That depends whether he has or not has the symptoms. If the patient just like we mentioned before, if the patient just the patients go to some area such as Hubei province or some other pandemic area, and he was keep isolated and maybe do not have to do the test for the viruses. But when he just isolation is fine for them. Yeah.
Okay. One more additional question here. Most of the cases, like as we have been saying, like screening test as a RDT and PCR, if both are positive, is it necessary to do CT scan of the chest or not? Because some of the cases, what we have seen is like after PCR, one PCR test is positive and one PCR test is negative. And is it necessary without doing CT scan of the chest? Can we say whether it is a positive COVID-19 positive or not?
Sometimes the images of the CT scan will give you some clue of the infection. And if you can confirm this with some IgG or IgM test, that would be fine. It can be make the diagnosis, help us to make the diagnosis.
Okay, thank you very much.
Yeah.
Thank you, Dr. Abhirod, and thank you, Professor Yao. So I see Professor Wang is still struggling to get back. Professor Wang, can you hear us? I don't know. Okay, I'd like to highlight to our participant that from both the professor, three of the professors are from Nanjing Medical University, and Nanjing Medical University has been putting a lot of contribution to fight the front line in Wuhan and Hubei province, also the other part of China. Nanjing Medical University already sent more than 602 medical doctors to different cities in China to fight against COVID-19. So plays a very vital role in fighting against COVID-19 in China. We have one more question from Upama. Upama, can you hear us? Can you unmute and ask your question?
Yes, I can hear you.
Yes, can you put the question and to which professor you want to ask?
Good afternoon all. This is Upama Gimirev, currently doing Masters in Global Health in Southeast University, Nanjing. My question is to Dr. Han. Does every healthcare person should go to quarantine after taking care of COVID patient before returning to public places or home?
Sure. With quarantine and nucleic acid test twice, if the test has been negative and the sampling intervals should be over 24 hours. And we also have been on the virus-related antibodies testing, like IgG and IgM. Well, although the risk of infection of the virus has been brought to a very low level for us, for our professionals, because we have had quite effective protections. Still, we've got to have quarantine for ourselves at least 2 weeks, and after that, we will have like a personal isolation or family isolation for like 5 to 10 days or even more, something like that.
Okay, thank you. One more question, Dr. Han. Do you think that, as per your experience throughout this epidemic journey, that COVID-19 can be controlled before the availability of the vaccine for general public?
Are you saying that about the vaccine?
Yes, vaccines for COVID-19. Do you think that Okay,
go ahead.
Okay, do you think that, as per your experience, that COVID-19 can be controlled before the availability of the vaccine in general public?
Yeah, I think so. The vaccine is so far away. We cannot even see the shadow of it yet. So before that, we will be able to control COVID-19. I'm quite confident with that, because but you've got to be aware that this COVID-19 disease, this COVID-19 virus is gonna coexist with our human beings for quite a long time. Maybe, just maybe next winter, or maybe even the winter after the next one, this COVID-19 will recur. So we should always keep in mind just this virus doesn't leave us away. It may be hiding somewhere.
Oh, thank you. Thank you. Thank you so much.
Thank you.
Okay, thank you, Upama. I just had a text from Dr. Wang again, and he has logged in from the cell phone. So, Dr. Wang, can you hear us now? Dr. Wang? I don't know who, because we have many queries for Dr. Wang, and like we cannot been able to listen to Dr. Wang. Okay, anyway, we'll go ahead with our one more question from Prati. Prati, you there? Can you unmute and ask the question, please? Prati Gimire.
Hello.
Yes, we can hear you. Please put your question, Prati.
Good afternoon, everyone. I would like to ask a question that what are the special measures that can be done to protect the pregnant and breastfeeding medical staffs during this quarantine time in the hospital areas?
Your question is for Dr. Han or Dr. Yao?
Yeah, Dr. Han.
Yeah, Dr. Han.
I'm sorry, could you repeat that question again, please?
Okay, what are the special measures that can be done to protect pregnant and breastfeeding medical staffs, usually like female staffs during the quarantine?
For female staffs,
Yeah.
we don't have special measures to protect female staffs.
Like medical equipment, special medical equipments for them if they are working, they are the high risk group. So that is there any special medical equipment for them?
Yeah, just when I was working in a team, female professionals got one right to protect themselves, because when the female professionals in the period time, they may be off work for just one day. And
okay,
do you think this is kind of protection?
No, I don't think that, because
it's quite difficult to separate male and female professionals. We just work almost, well, exactly the same.
My question was not for the okay, the next question is how can we discard the medical equipments that are used while treating the patient of COVID-19?
First of all the equipment, if the equipment have to be discarded, it should be sterilized by spraying chlorine sanitizers, or sometimes ethanols, and after that it should be sent to special area for special technicians to deal with that. And the exact procedure, probably Professor Wang would be able to answer that, but unfortunately he's right now not online.
Okay,
I'm sorry for this.
Okay,
Yeah,
thank you, ma'am.
Yeah, thank you, Pratiksha. Yeah, that question was probably had to be answered by Dr. Wang, but unfortunately we are not able to connect Dr. Wang. And we have my old friend also raising a hand for the question. Dr. Pravindra is here. Hi, Pravindra. Can you put your question, please?
Yeah, this is a similar question, doctor. Do you recommend any? I'm a dentist here in Nepal. So, do you recommend any dentist to do the routine dentistry in this chaotic situation? Like, what are the measures we need to seek before going for any aerosols generating dentistry?
I think Dr. Han can answer that question. He's a dentist and he's asking what kind of precaution he needed to take before going for any procedure. Is that correct, Pravindra?
Yes, yes.
All right. Regarding to this question, I think you should be aware the patient you are treating is
We cannot hear you, Dr. Han. Can you check his speaker, please, Mike?
What
We
about
cannot hear
now?
you. Yeah, we can hear you now. Yeah.
Yeah, okay. Regarding to this question, I think before you've got to treat the patient, you've got to know the patient is suspect case or not, or even confirm the case of COVID-19 or not. If it's not, you better treat the patients in the regular way. If it is suspect or confirmed the case, I think generally the hospital should provide a special area or special operation or even treating room for such patients, a separated ward, a separated treating room is a basic requirement for that. And remember, during such situation and in quite a long term, N95 masks would be, very much high demand. I strongly suggest that the hospital and the government should put great effort in providing N95 masks. Even without the protective gowns, even without those gloves, I think with N95 you are 95% safer than others, especially for medical professionals. Do you think it's okay?
I think that made your answer, Pravindra.
Yeah, as far as so far it's very convincing, but the thing is, in today's reality, there are no any patients where we can say this is a suspect and this is a non-suspect case without doing any PCR testing. So with through the questionnaire in the trials clinic, we are not sure whether the patients are COVID positive or not negative. That's why we are so confused, and it's a very scary to go after any patients and do any aerosol generating dentistry in anywhere in the world. So this is a very tricky situation for us whether to go for it or not. So N95 is, yes, it's the most, it's a must and a mandatory respiratory mask. And yes, we are.
Forward.
Now we go ahead.
If you are lack of N95, at least a surgical mask it's the most basic providing for dentists. I have seen one paper which was comparing the surgical mask with N95. It actually that there's no significant difference between surgical mask and N95 in protecting medical professionals. So in case of lacking of N95, I strongly recommend you wear double surgical masks. This is that I cannot compromise anymore. Okay.
Okay, Rosen.
Yes.
Rosen,
Okay. Yes.
can you hear me now?
Now we can hear you, Professor Wang. We have been waiting from last 1.5 hours. So can you?
I have changed 2 computers and 2 cell phones.
Okay, anyway, we are happy to have you back. You are very much familiar with Nepal. You have been to Nepal. You have most of your participants is your students as well, whom you already met. Everyone is there. They're listening to you. Yeah, go ahead with your introduction, Professor Wang.
Yeah, sorry for delay because I prepared it for 2 days. Now I use my cell phone, so I can't present the PPT for you. Just if you have some questions, just please ask me. I would like to answer based on my knowledge.
Yeah, Professor Wang, he's an epidemiologist and also public health professor. He has been working in our university for a very long time, and he is one of the eminent professor in public health. And recently, he visited with me to Nepal. He had seen a couple of hospitals and met many doctors, and also visited hospitals over here in Nepal. So he's very much familiar. We have, I think, a lot of questions for you. Just now there was a question from Upama. She's also a student in Southeast University in China. She asks, what is a proper way to discard the medical equipment, like after it has been used? Can you reply on that? She's listening to that.
Okay, sure. I think during the pandemic of COVID 2019, the medical equipment is a very important resource for all hospitals. I think first, each hospital should prepare necessary equipment by themselves, as that's the first stage of the pandemic. You know, in China, we have from a vertical management system, from the National Health Commission to local health commission. So the provincial and the National Health Commission can help us allocate the resource by considering the responsibility and the demand of each health facilities. I think now there are few cases reported in Nepal. The lack of necessary equipment is not so serious, but I think each hospital should prepare it beforehand. First, the face mask and some necessary medical equipment. You should prepare it beforehand in case there are more and more cases happened in your hospital. You will face a big problem at that time. Yeah.
Yes, thank you, Professor Wang. We have Shramik online. Shramik, can you hear us? Can you just unmute and ask a question? Professor Wang is here. Shramik Shrestha.
Hello, regards to everyone.
Yes.
I'm biomedical engineer from Southeast University, and my question is, do you have any experience of reuse of PPE or any medical equipment? Considering the possibility of shortage of the medical equipment, is there any possibility of reuse the PPE, or do you have any experience how to do that?
You are talking about the reuse of PPE. In fact, it depends on which type of PPE. Like the face mask, at the earlier stage of the pandemic in China, we are everywhere. We are lack of necessary supply for face masks. So at this time, we usually use the surgical mask or general medical mask for several times. But you are working in some designated hospitals to treat patients. You need to use N95, these face masks. You should be strictly follow the guidelines. It's not recommended to reuse this PPE. So whether to reuse it or not, depending on the resource and the environment you are working. For general population, I think it's possible to reuse. Or usually in China, we use the general medical mask, face masks for several days.
Yeah.
For clinical doctors, you need to think about your risk of infection.
And also, like in Nepal, currently some people are working to prepare a gown, like locally preparing the gown. So there is we need a time to validate if it is fully protective to use that gown or not. But it's still to overcome the shortage, they are preparing that gown. Is there any protocol, like how to validate that the gown is protective to the health workers?
For these gowns, I think each country are facing this problem because during a short time period, it's difficult for the factories to produce a lot of gowns for clinical use. I think in China, I think Dr. Han or other doctors have this experience. The supply of these gowns is limited, so I think a lot of doctors and nurses they don't drink too much water to avoid using the toilet, because when you use the toilet, you need to change this PPE. So they can keep on using one suit of gowns for a relatively long time. But if you take it off, it's not recommended to use it again. The individual safety is more important.
Yeah, true. Thank you, Lao Shi.
Thank you, Susan. Upama Sharma is here. I think she has a question for Professor Wang. Yeah, Upama, can you put your question, please?
Good afternoon, Dr. Wang.
Yeah, good afternoon.
I'm also MPS Global Health student in Southeast University. So
that's never into us.
So I want to ask one question to you, that what is the probability of medical frontline worker to get infected of COVID even after using protective devices?
You are talking about the risk of infection for medical frontier workers. I think it depends on whether you have performed effective individual protection. You know, in Wuhan city, where the COVID cases first occurred, thousands of doctors and nurses were infected, mainly due to the lack of awareness at the earlier stage during the outbreak of this novel virus. After that, I think more than 40,000 health workers from other cities of China were sent to Wuhan. They are usually working at the designated hospitals in that area. I think the risk of catching infection is the same, but among these over 40,000 health workers, nobody was infected. So it depends on whether you have effective individual protection. So the PPE is very important.
Okay, thank you, Professor. One more question I would like to ask you. As per your knowledge and experience, in your opinion, what role should Ministry of Health and Public Health Bureau should play during this epidemic time?
You are talking about the Ministry of Health. That's administrative health care officers. At the first stage of this pandemic of COVID, I think the clinical doctors are the first one to detect this novel virus. Then the CDC, or we call it the public health staffs, can detect the outbreak and help control the epidemic. What's the role of the Ministry of Health or Public Health Bureau? I think they are playing an important role in implement the strategies. You know, the government have less knowledge on this novel infectious diseases. The Ministry of Health and the Public Health Bureau should provide some information or suggestions or recommendations for these policymakers. They should be responsible for the allocation of medical resources, the organization of scientific research, the formulation of diagnosis and treatment guidelines. And also they are responsible for the insurance of prevention and control measures. So during the outbreak or epidemic of this novel disease, the Ministry of Health and Public Health Bureau plays a very important role for successfully control this disease. But you know, for general population, they care more about the clinical doctors and nurses. Usually for Public Health Bureau, they are working behind and get more and more being criticized.
Yes.
Yeah, I think you are working for the government.
Yes, yes. Okay.
So thank you.
One more last question I want to ask to Dr. Wang. So we all know that WHO has strictly ordered to stay home and maintain physical distancing. So, but in context of Nepal, till today date now, we have 49 cases and I think 11 is treated. So in what do you suggest, that should Nepal have to continue lockdown?
You are talking about lockdown. You know, you may have already watched from the television or listened to the radio. In Wuhan city, it's totally shut down since I think just before the traditional Chinese Spring Festival. Only Wuhan is totally locked down. For other cities, in fact, the government just suggests us to stay at home. You still can go outside. For other cities, it's not totally locked down. For you know, when this disease occurred, that's the winter holiday of China. So a lot of students have gone back to their home. So that's a good opportunity for us to ask the students, ask the workers, ask the residents stay at home. But you know, if this outbreak happened now, I think it's we will face face difficulties to recommend everyone to stay at home. So the winter holiday have given us opportunity to slow down the transmission of this virus. For Nepal, I think the number of cases is not so high. To ask people to keep social distance is important. But I don't think it's not necessary to ask everyone stay at home. Just recommend them to keep social distance, avoid some aggregation, and short and how to say, don't go outside for like go to the hospital, go to the restaurant.
Yeah, true.
Dr. Wang? I think
Dr. Wang internet is
the outpatient. Yeah.
Okay. Yeah.
It's very important.
Okay.
Okay, thank you, Upma.
Thank you, Dr. Wang.
Yeah.
Yes.
We have question from Dr. Krishna Gopal Vuju. I think Professor Wang knows him very well. He is a current alumni president of Nepal, Nanjing Medical University alumni president. So he have a question for you, Dr. Wang. Yeah, Dr. Vuju, go ahead.
Hello, Dr. Wang.
Yeah, hello.
Can you hear me? Good afternoon,
yes,
sir.
I can hear. Good afternoon.
Good afternoon. As you know, I'm working in the Nepal Army.
Yes.
We have a screening team for that COVID infected area. We send few screening team over there. They will collect the swab. They will collect the swab of a few hundred people and they will come back. Until the swab is checked by PCR, if the PCR comes positive, we put them for quarantine for 2 weeks. Do it necessary to put them the quarantine, or they can leave that? While taking the swab, they will fully wear the PPE, and they were fully protected with PPE.
In China, for clinical doctors and nurses who are caring COVID patients at the designated hospitals, when they finish their job, their tasks before returning back to their home or going back to the general ward, they are asked to be quarantined for at least 2 weeks and being tested for nucleic acid 2 times. Now I think they are also at the antibody test, because in China we find more and more asymptomatic cases. They don't have any symptoms, but they can transmit the virus to general populations. So at this stage, I think NIBO will pay more attention about the patients, the confirmed patients and the suspected patients. At the later stage, I think you will pay more attention to asymptomatic patients. It's difficult to distinguish them. For those, I think you mentioned about this healthcare staffs who took samples for patients. Yeah, to protect, I think to protect themselves and to protect their family members, it's better to put them in the isolated hotel for at least 2 weeks and test using the PCR to test the nucleoside at least 2 times. The interval is at least 48 hours before this 2 tests. Okay.
So
okay, thank you,
Dr. Vuzu. We have a question. Somebody texted me for Dr. Wang. Can we use 10% hydrogen peroxide as a fumigant for N95 masks? For Dr.
You mean
Wang.
the prophylaxis?
She's asked us like, can we use 10% hydrogen peroxide as a fumigant for N95 masks?
Currently, I think in the world we don't have enough treatment. Also, we don't have some effective. We don't have effective therapy for COVID. We have 2 clinical experts for clinical patients. I think the treatment just for the symptoms or signs. We don't have effective antivirus drugs. Also for prophylaxis drugs, I don't think like some TCM drugs or hoops is effective. Currently,
Dr.
according to my opinion, no effective prophylactic drugs to prevent COVID.
Yeah, that was a question from Subi. Subi, you are there. Did it meet your requirement? Subi? Dr. Subi?
No, Dr. Wang. Hello? Hello?
Yeah, we can
On
hear
the
you. We can hear you.
We can hear.
Hello? Da.
We can hear you. We can hear you. Go ahead with the question.
Question này.
Yes, we can hear you. Subi?
Go ahead,
Dr.
go ahead,
Hello,
please.
Dr. Wang. The question was,
Yes.
can we use, the question was, Azur,
Your voice is breaking. We
can
cannot
we
hear
use
you, Dr.
10% of
Subi.
hydrogen peroxide as a fumigant for decontamination of the N95 mask? For the can we use
The quality of voice is
10%
not so
hydrogen
good.
peroxide as a fumigant for decontamination of N95 mask? As a decontamination of N95 mask.
I think you are asking about
Hello?
can we reuse the N95 masks?
After using hydrogen peroxide to decontaminate it, can we use after the
Can we
decontamination?
decontaminate it with
You know, some Chinese researchers
can we use
have
10%
developed.
hydrogen peroxide for decontamination of the N95?
Yeah, I understand. You are talking about whether we can reuse the N95 masks after decontamination. You know, during the at the earlier stage of this epidemic, some Chinese researchers have performed some studies on the decontamination and disinfection of N95 masks. But in fact, we don't recommend you reuse the N95 masks. When you decontaminate it or disinfect it, you will destroy the N95 masks. So it's not recommended.
Thank you, Dr. Wang. Thank you.
Thank you.
You're welcome.
Thank you, Dr. Subi, for that. We have the question all along from UK. Can we have the question? We have my sister Jaya from UK. Yes, she's here. Yeah, we have three experts here. Jayadi, you can put the question on the floor, please.
Good morning, everyone. Oh, sorry, good afternoon. First of all, I would like to say thank you all for your effort to bring this webinar and providing us such a valuable information. I used to work for the NHS as well last 10 years as a coordinator for the training, providing the training for the doctors and nurses and all this. But now I didn't work. But now, as a lay person, I wanted to ask the question compared to UK and Nepal, as even in the UK, the mortality rate is really high, and we are still watching news and saying there is not enough PPE and all these marks, basic needs. Whereas in Nepal, it's we don't have any capacity of lab, and even the concern regarding the not enough PPE. So how to protect our frontline doctors. And also I was watching, the news is already plays a vital role for us. And yesterday I was watching one of the news is saying that one of the guy, I must admit I'm not good in geography, but the one guy from Sarlahi went to the Biratnagar hospital and then found out he's COVID positive, but he went home or something. And so in that case, is there any facilities or arrangement can be done in the hospital so that those patients can be treated? Or because over there is no like a COVID hospital, separate hospital for the COVID patient. Although there is a less patient when you're 49 and 11 are already discharged. But in the worst case scenario, if you can do something like a separate ward or ICU in every hospital, these are the questions for the doctors in Nepal. And also one question for the Dr. Han, maybe I can ask, like, yeah, lots of like people, like as she has treated lots of like a patient day in, day out. So it must be very exhaustion, not only from the physical, but also like emotionally and mentally kind of things. So what and how did she cope with all this stress? And what's the one advice if she can give to these like new frontline doctors?
Yeah, that was a question for Dr. Han. Dr. Han?
I'm over here.
Yeah, did you hear the question?
Yeah, I did hear, but I don't.
Jayadi, can you? Okay, Jayadi, can you just ask the question straight to Dr. Han, please?
Okay, the question is, so you have treated lots of like these patients day in and day out. So it's not like a physically strained for you, but also it's like emotionally and mentally. So how did you cope with this stress? And if such kind of scenario come to Nepal as well, what's the one advice you can give to our frontline doctors, how they have to cope with this situations?
During that situation, I was quite excited to be of helpful. I didn't feel very much stressful, except at the beginning when I didn't know anything about COVID-19 yet. But after a week of working in that front line, I felt quite comfortable with that situation, except those difficulties working with PPE, you know. But coping with those situations was not difficult to me. The most emotional time for me would be like seeing infected doctors or infected nurses going away from us. That was extremely hard. That's probably very much difficult for all. But after that, we all strengthen up all together to fight this disease. We just have to do this. We don't have time to think much more. I'm sorry, but I don't have very many suggestions to deal with this psychological problem, because we also have our psychologists in our team to help us to deal with such scenario. I think it will be great to have a psychologist in any frontline teams to protect professionals. What do you think?
Yeah, that's the best option, because here also lots of like frontline doctors and even like social care, they are like dying from this COVID, and then there's lots of like a pressure for the frontline doctors and nurses, and then there's really like emotionally drained and they're crying and all this. So that's another option as well, if we can keep any like psychological doctors, or who can like motivate the doctors, that would be the great option. Thank you.
Thank you.
I hope that met your reply. So we almost at the end. So thank you all, Professor Hani, Professor Yao Xin, Professor Wang Jianming, to be with us and speak on behalf of COVID-19, and also help us to fight against this battle, against the battle of COVID-19. I would like to give a floor to our president of alumni in Nepal, Dr. Krishna Gopal Buju. Can you summon up, and I'll give it back to Kalpana. Can you summon up and give the thanks to our speakers, including Dr. Jagdish? Dr. Buju.
Okay, thank you, Dr. Roshan. Thank you, Roshan. Sorry. Thank you, Roshan. Can you hear me?
Yeah,
Yes,
we
sir.
can hear you. Yeah, we can hear you.
It's our great pleasure to have all distinguished guests from China. China, especially the Nanjing Medical University, where we taught, where we studied, and a lot of people get expertise from there in the Nanjing Medical University. And still, in such a pandemic time, also they have given us a time to conduct a webinar on COVID-19, how to manage the cases and uh, how to how to deal with such pandemic conditions. We are very grateful to them, especially Professor Dr. Hani, who delightfully explained about her experience in Wuhan, which encourages our frontline doctors' motto to treat the patients, and they are not afraid to treat the patient in frontline. I guess your enlightenment encourages us to treat such a patient. Thank you, Dr. Hani. And Dr. Yao, you too answer all the participant questions very nicely, very well. We are very much grateful to you. And last, Professor Dr. Wang, as your expertise are fully explored over here to manage in the community level community things. Thank you, Professor Dr. Wang too. And ultimately, we have to thank all the participants of the webinar, without whom the webinars cannot be complete in a sense. And lastly, the organizers, uh, technical technical support by Nepal Internet Foundation, and logistic support by Rotary Club of Mokwanpur are also 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 the uh, also also the also the part of organizer whom we will cordially like to thanks. And of course the Dr. Jagdish from away, who have shared his knowledge about the management of geriatric patients and all these things. Thank you. And thank you, organizers teams. And thank you, Dr. Rosans, who untiringly support us to participate in such a good, nice webinar. Thank you all. Thank you.
Thank you very much, Dr. Buju. You have always been a part of us, and we are very much proud that you are serving in Nepal Army. He is working as a dental doctor in Nepal Army. He's also in frontline. Last time when I had a talk with Dr. Buju, he was going to hospital to attend an emergency case. Although with all his busyness, he attended this. Really appreciated. And we have the host. Nepal JC's Untitled Chapter President, I would like to hand over the mic to Kalpana. Kalpana, you there?
Yeah, I'm here. Did you hear my voice?
Yes, Kalpana. Yes, go ahead, Kalpana.
Thanks, Rosan. For today's session, I would like to request to have the remarks by JC Sivabhushan that he is assigned VP from Area C from Nepal JCs.
Thank you so much, Madam President Kalpana Shrestha. As always, thank you so much for Dr. Hani, Dr. Chin, and Dr. Wang. As well as all the doctor participated and all the medical person. Especially, I would like to thank you so much for at the first for the Kalpana Shrestha. She created this platform for the those technical people to be together and exchange the experience each other. Experience is one of the best university in the world, and we got such a good knowledge by the three doctors experience today, and that will help to get more encouraged for our doctors who are working in front of the COVID-19 patient in front of them. It is a big challenge for those people, as well as they are so courageful and they are giving such a new life for the people. JCI Nepal really appreciate for all of you. It is very good program. I attend beginning to the end, and it was so good. And according to the SDG number 3, Sustainable Development Goal, my good health and well-being, Kalpana Shrestha think about this situation and identify the problem, and it can be the one of the best moment to organize these things. So we'd like to give you thank you so much for all of you, and we'll be again together for such kind of program again and again. As well as I would like to give you such a dynamic personality, Dr. Roshan Shrestha. He's doing so good, and thank you so much, Dr. Roshan, as well as thank you all of you, and have a wonderful time, and be always with us. We'll be very happy to be with you. Thank you.
Yeah, Kalpana. Kalpana?
Your voice is...
We cannot hear you, Kalpana.
Did you hear?
Yeah, now it's okay, yeah.
Yeah, thank you, Sivaji, Sivadai. And this floor goes to Roshan. Can you continue this program again?
Yes, thank you. We are already in the end. So before closing this, I would like to thank to Professor Chung Yu and also Mrs. Chow, who has been helping us from China all the way. As I'm also the part of Nanjing Medical University, and I'm here in Hetauda, my hometown. So I would like to say thank you for all my 3 professors for excellent support, and thank you participants who has been patiently listening for all 2 hours time. And I think we'll go ahead with this kind of webinar again if we have a chance. So thank you all. I really appreciate you guys to be here, and it's really good to see you all. And especially I have my friends and students joining from all around the world. I can see from India and from Kazakhstan and all those countries, and especially I'm happy that my sister also joined from UK, and she also supported me all the time. Thank you, Jaya Didi. And I'd like to give floor back to Bikram.
Thank you very much, everyone. This is one of the great opportunity for us to have you all in this session, and technically I'm supporting this because of there is lots of technical aspects, and even the attendees across 100+ attendees today, they had participated in our webinar, and I guess this is one of the great opportunity for Nepal. So the experts, doctors from China, thank you, Dr. Yan and Dr. Yao and Dr. Wang, who had contributed for this session. So I would I thanks entirely all the participation, and this is one of the great sessions I have attended till today, because in Nepal we have very limited resources, and we have been working with the limited resources, and even the capacity building and awareness is one of the agenda for us to get the export best practices over in China, one who had frontline doctors to treated their patient, and in Nepal we'll have this session. So thank you very much for everyone. So now it's almost 3:06 in Nepal PM. So over to Roshan. Thank you, Roshan. Thank you, Gyan Krishna Prajapati. Thank you, Kalpana. Thank you, Nepal JCs. Thank you, all doctors who had get this opportunity. Thank you very much.
Let me close with that. 非常感谢3位教授，因为我知道你们在很忙，但是我非常感谢，因为你们留给我们时间。王院长已经来过尼泊尔，然后尼泊尔的情况他比较清楚。还有姚主任跟韩主任，非常感谢你们2个人参加。我觉得我们的这边的医生都非常感谢你们，谢谢，非常感谢。
不好意思，今天的技术故障，晚了。
没问题，没问题，
OK，
一定好了，
拜拜。
谢谢。再见，再见，再见，安主任，再见，拜拜，See you all，
再见，再见，拜拜，
拜拜。
Thank you. Thank you, everyone. Thank you.
Thank you so much for everyone.
Adjourn for today. Thank you.